Bula Vinaka. Welcome to Quick Reference Guide on creating a patient using the Sova Ni Bula website. In this video, we will look at how to create a digital patient profile on the Sova Ni Bula system. Step 1. Log into Sova Ni Bula using your credentials. In this video, we are using the Medical Recorder login, where you can see that the only feature accessible to the Medical Recorder is creating a case. All other users also have access to creating a patient. Step 2. Click on Case Management, and from there you will select Case Management and then go to Add Case. Here you will see the 4 tabs where you can enter all the patient details when creating their case. Step 3. Enter the patient's basic details under the Profiles tab. In the Profiles tab, you have the patient's demographic details such as title, first name, surname, NHN, folder number, father's name, birth date, alias, which is any other name that they go by, marital status, sex, nationality, religious affiliation, smoking habit, ethnicity, blood group, and deceased status. We will now enter a test patient for this example. Please note, the NHN and the TIN number must be exactly 9 digits. Please avoid adding spaces, as an extra space may be counted as a 10th digit and not be recognized by the system. For example, if I am to add an extra space behind 2, it will recognize it as a 10th character. Next up is the folder number. Please note, the folder numbers vary by health center. However, some health centers may use the NHN as the folder number. If that is the case, please enter the NHN again as the folder number. For birth date, upon clicking on it, a calendar will appear. To select the year, click on where the month and the year are displayed. From there, click on the year again. This will bring you to a list from where you can scroll through and select the year in which the patient was born. Select the month, followed by the birth date. Under alias, you may enter any other nickname that the patient is referred by. Religious affiliation is given here in order to help dietitians identify any religious restrictions on diet. Please mark the patient as no for their deceased status if they are still living. Once you are done with entering the details under Profiles, scroll up and select the Contacts tab to enter the patient's contact details. This brings us to Step 4. Entering the contact information. Please ensure to enter the street name in full. Accordingly, you will select the medical area that patient belongs to as per their street address. If the patient resides in a different medical area but is receiving SOPD care at your clinic, enter the actual medical area and zone. This ensures accurate patient classification in the summary and dashboard reporting function for medical offices. Under mobile, you will have to enter the country code followed by the mobile contact of that patient. Under home phone, you may enter any landline or emergency contact of that patient. Please also enter the country code over here. You may enter other relevant details and then move on to the next step. Please note, if a patient's mobile number is unavailable or they do not have any form of contact, you may enter the area code along with all 0 digits as a placeholder. This should then be updated by the nurses when the patient next visits the clinic. Step 5. Select the Cases tab. Here you can enter the pen color, clinic type, and other relevant patient details to ensure easy reference for medical offices. For the pen color, you'll notice that we have a white category, and this is used to denote patients who have a new medical folder, or are mental health cases, or RHD cases. Please note, when entering the pen folder color while creating a patient, please check the cover of the folder to note if the patient was recategorized but yet to change the color of the cover. If that is the case, the nurse will write on the colored cover the next pen color that patient should belong to and the date at which that pen color change was assessed. In that case, please enter the color that is written on the folder. Under clinic type, you have 2 options, clinic and home. Clinic is used to denote patients attending the clinic in person, whereas home cases are selected for dorm or home visit cases. Please choose accordingly. Under the summary, you may record the diagnosis along with the pen color change and the risk percentage. For example, if this patient was previously on any other color, I may note it down as This will help the medical staff keep track of the pen color changes. Under history, if there are any other relevant history that is not given here, you may mention it here. Under family history, please enter any known relatives with NCDs such as diabetes, hypertension, stroke, cardiovascular diseases, or cancer. For example, in this case, you may also enter the social or occupational history, which will be useful for the physiotherapist to know in order to denote the level of exercise to be prescribed. Also enter any allergies that the patient may have. This will include environmental allergies, food allergies, and medicinal allergies. If this information is not known at the time of recording this folder, the SOPD nurse may ask the patient when the patient arrives for clinic. Majority times, the patient's allergies will be stated inside their medical notes. So please search through the folder to note down any allergies that the patient may have. Under past medical or surgical history, you may note down any previous admissions that the patient had. During triage, the SOPD nurse may ask the patient these details and edit the patient's profile to update all these information. Step 6. Scroll up and click on the Diagnosis tab. You may note the diagnosis of the patient given in the last page of the manual pen folder where the doctor has made the assessment. Sometimes the diagnosis may also be written on the first page of the folder. Here you will find two types of diagnosis. One is primary diagnosis and the other is secondary diagnosis. Primary diagnosis is the main condition that the patient attends clinic for. Please select only one radio or circle button for the patient's main condition. For secondary diagnosis, you may select multiple checkboxes for any additional condition that the patient might have. For example, in our case, this patient also has asthma. If the patient has any other condition that is not given on this list, you may scroll down and select others. Here, you may type in the condition that the patient has. Certain conditions may also require further classification by typing on the line provided next to it. For example, if this patient were to have anemia, I can further classify the type of anemia by typing. Step 7. Click OK to save the patient's digital profile. Once it is saved, you will see this. It indicates that the patient record has been successfully saved. For medical recorders, due to confidentiality, you will not be able to see the case that you have saved. However, nurses, MOs, dietitians and physiotherapists all have access to case management, where they can see the patient that has been created as well as edit the patient's profile. Thank you for watching. Vinaka.